East Cooper knows health, and that includes breast health, especially during this Breast Cancer Awareness Month. The Charleston Breast Center reaching out to women in the name of detection. Dr. Lisa Barron joins us this morning. Thank you for being here.
Good morning.
Well, Dr. Barron, how do you screen for breast cancer?
That's an excellent question. Breast cancer screening actually involves three components. We have the mammogram, which we had a nice little commercial beforehand that shows the women taking the picture, and that's using X-ray, and we start that usually beginning at age 40 for women who do not have any risk. For women who have risk, we tend to start screening those patients about 10 years before. Say their mother had breast cancer at 45, we would start someone at 35. The next very important component is your monthly self-breast exam, which you're actually examining your breast as well as your armpit. But you're also looking for some signs of breast cancer that you should report to your doctor.
Yeah, like what? What should we notice that would be different?
Well, one thing that is very subtle is nipple discharge. And so some women actually present with breast cancer by saying, I took my bra off and I noticed a little bit of blood in my bra. And that's a very worrisome symptom that needs to be reported immediately. It does not mean that the person has breast cancer, but it's one of the things that we look for. Another thing, if you start noticing that one breast becomes smaller, believe it or not, some breast cancers will present with the breast actually shrinking in.
Wow.
Some breast cancers present with the breast growing, so you'd want to look at symmetry, and that's why we ask people to look in front of the mirror. Another thing is the nipple. If the nipple's going inwards, we'd also want to make sure. And then the third component of breast cancer screening involves your healthcare provider, who is also double checking your clinical breast exam to make sure nothing is there. And the reason for having to, why are we doing the clinical exam when we have the mammogram?
Right.
We know that mammography is unable to detect all breast cancers. We also know that different women have different composition of breast.
Like our dense breast tissue.
Correct.
Okay.
And so in two general categories, we have women who have mostly fatty breast tissue and a little bit of glands. And then we have women who have very dense breast tissue and lots of glands. And the way I like to explain this to my patient is that if you go outside at night and you're on the beach and you look up at the sky and there's lots of stars and the moon, that's the patient who has very fatty breast tissue.
Okay.
You take someone with dense breast tissue and put lots of clouds up there, all of a sudden you can't see the stars, you can't see the moon, and those are the women who particularly we need to pay attention to the clinical breast exam.
And you do more of an ultrasound with that.
Correct.
Is that different than an X-ray?
Correct.
Okay.
The mammogram, we need to use them together because the mammogram gives us information such as calcifications. That's one of the things we look for breast cancer or small masses. But the ultrasound's able to cut through all that dense tissue to make sure that you don't have something sitting in the dense tissue that we just couldn't see.
See at that time. Okay, well, can you prevent breast cancer? Because, you know, there are some women and oftentimes some men who have no history of it in their family whatsoever. They may be the first one, or there's someone who has that history of it. But is there any way to prevent, any things, preventative measures that you can take?
Excellent question. What I generally tell people is maintain a healthy lifestyle. So we know that smoking can increase your risk. We know that people who don't work out, who have high fat diets, some alcohol, these things can increase your risk. Also having knowledge can decrease your risk. So knowing the risk factors, participating in an annual or yearly screening program also decreases the chance of dying from breast cancer. Now there are women, probably about 20% of our patients who are diagnosed have a genetic reason for having breast cancer. And in those patients, they can actually prevent breast cancer by having prophylactic mastectomies and removing the breast tissue that could lead to cancer. It's a very, very small population. Most of our patients, 80 to 85% of women who get diagnosed have really no family history for breast cancer. So it's kind of scary when you walk in and you're having your screening. Am I really at risk? The biggest risk is being female and growing older.
Yeah, and so you said you should start getting those annual mammograms at 40, especially if you're not at high risk.
Correct.
And then how often after that if you're not at high risk?
Every year.
Every year. Now, is there anything that you can do to prepare for a mammogram?
Yes. Preparing for a mammogram, making sure all your records are at the facility, that you have the order there, and not wearing deodorant, because deodorant has some talc in it that can mimic calcifications, which is one of the things that we look for breast cancer. The other thing is to schedule, if you're still having your menstrual cycle, to schedule it when your breasts are least tender. Okay. And then also to communicate with the technologist who's doing your exam, because sometimes when they're positioning, there might be a little pinching of the skin, and just to communicate that with them. And in general, most people say it's not that bad. It's not like some of the cartoons that we see.
Oh my goodness, right. Well, Dr. Barron, thank you so much. Early detection is key.
Well, thank you for having me.
All right, of course. Well, Goodwill wants you to put on your masks and dress up for a good cause, and that's just ahead on Low Country Live. And the Coastal Carolina Fair just days away now, and we'll tell you about classic standards plus what's new this season. Stay with us.